So the solution for all headaches and migraines, first you got to check nerve pressure. Why? Because this is the source of, we're talking 99.9% of all headaches. Find the cause. Absolutely. I have never seen in all the research that the cause is Tylenol or Advil deficiency. I know, it sounds ridiculous when I put it that way, but we got to start bringing common sense back into healthcare. Water. Ideally, dehydration and headaches are the most common. Sleep deprivation, will also cause headaches. And also toxicities, those environmental toxicities. Now, I'm going to show you a series of slides. Now, this is a normal, beautiful curve in the neck. The reason I'm going to show you these slides, because they were done in 1961. Now, modern medicine, this was 48 years ago. Has our science improved in 48 years? Well, not by much. Not by much. The same percentage of people that get cancer, the same percentage that dies, therapies have not improved that much, and that's frustrating. So we're talking almost 50 years. So 48 years ago, this picture was taken. Now you can see, going on comparisons of a normal, beautiful curve, loss of curve. Now this patient goes into a medical office, and that's where we got these films. Now she was diagnosed with headaches and shoulder pain. So now what was she given? Pain reliever, muscle relaxant, anti-inflammatory. Okay, now those medications are designed to cover it up. The tough part is the body intelligent, yes or yes? Is the body built by God? Yeah, it is. It really is. So it's smart. So when we look at a normal neck, the top of the head should be over the bottom. Now for every 1 inch that heads forward, the pressure doubles on the discs. So now if that heads forward like this, those muscles are going to spasm out to reposition that head. Does that make sense? Oh gosh, yeah, it's a brilliant response by the body. The tough part is pain reliever, muscle relaxant, anti-inflammatory. You relax those muscles, which way is the head going to fall further forward? 2 years goes by. The woman is still hurting here. And now we're seeing progression of the degeneration. Those discs are starting to be destroyed. Miss, you have degenerative joint disease. The tough part is we reverse degenerative joint disease. At this stage, this disease, which is supposed to be progressive, is reversible. Now she's taking more medications. What's her blood sugar like? Because we already know that pain will elevate blood sugar. What's her blood pressure like? Elevated. What's her digestion like? Worse. What's her immune system like? Worse. 1965, we're seeing progression of this bone, progression of that degeneration. Now, does anyone want to scream, reverse the degeneration, regrow the disc? It can still be done at this stage. 1968, look at that huge, nasty lip. What's her blood sugar? What's her blood pressure like? What's her symptomatology like? It's crazy. If you have more respect for the body, this would never happen. This wouldn't happen back then. 1972, it's now progressive and degenerative. This is called degenerative joint disease, degenerative disc disease, or osteoarthritis. This is what we reverse every day in this office, and what you're seeing progressing is destroying this woman's life. Okay? That's just flat out wrong. 1974, destroyed beyond belief, nearly fused. What's her thyroid function like? What's her glands like? Last one we have. You can see bony, lippy, spurring. She's a candidate for surgery now because we've made her comfortable while her body's rotted over the last 14 years. Okay, no. The line is drawn here. Okay, Captain Picard would say the same thing in Star Trek. Okay, we stop it now. Okay, there is a solution to this, and it's a human solution. The problem is, 48 years ago, have the therapies changed? No, they do now. Now we know, everybody in this office knows that arthritis can be reversed. This never needs to happen. Anyone that has mobility of the joint can be reversed and corrected. This is the key, not just to headaches, but to life itself. So we stop that so that never ever happens again. Proper nerve supply, absolutely. Free of subluxation, that means normal healthy joints. And joints get healthier as we age, not deteriorate. Regular exercise to detox, proper nutrition. This means that if man makes it, don't eat it. If God made it, eat it. Sufficient rest. This means sleep every night, REM state of sleep, without TV watching, 15 minutes before. Prayer, meditation. Why? Because we're spiritual beings. We have a relationship with God. And is this scientific? Tons of studies that show that prayer and meditation increase cell production. That's the only reason we do it. Now, on this, I gave you, this explains in detail a couple of tricks that you can do. I also gave you some really good, well, not really good. They're my recipes, okay? I think they're delicious. But if you're curious at how to eat healthy, the reason I'm putting this on here, you'll see you're cooking with coconut oil. Why? It's healthy saturated fats. You're seeing garlic. Why? Because it's antimicrobial. You'll see cayenne pepper. It's a vasodilator. Let food be your medicine and medicine be your food. This is where it starts. Okay, so these are some phenomenal recipes. But this should never happen again. Okay, we talk about the Holocaust, never again. Never again. Okay? This is something that we can stop now. So, now next week, we're going to be talking about stretching. We're going to talk about how to keep joints mobile, how to stretch at a desk, what real stretching means. Should you stretch before and after a workout? And you're going to have some specific examples, but you're going to be amazed at how flexibility can increase as you age. No. Now, first off, eye strain headaches, because there's a couple of different types. Now, let's say that you're studying a lot. Me, I'm a readaholic. I'm going to show you a trick. How many people in here have ever experienced an eye strain headache? Okay? Now, if I was lifting bricks, okay, in the yard, it would take about a day for my skeletal muscles to relax, okay, and refresh, maybe even a day and a half. But this is skeletal muscle. The muscle that causes eye strain headache is smooth muscle. It's like organ tissue. So it can replenish itself in about 30 seconds. Where this muscle takes a day and a half to relax, your smooth muscles can relax in about 30 seconds. So how about I give you the solution to eye strain headaches in 30 seconds or less? Does that make sense? I know. Wouldn't that be cool? Okay, watch this. What happens is, have you ever seen, when you're in a dark room, you've got a dark part of your eye called a pupil. When you're in the dark part of the room, it opens up and it relaxes. So it allows more light in. So what we need to do, we need to put the eyeball in a dark environment and open it. So now, do me a favor. Cover your eyes. Now, you're going to make it really, really dark. Okay? As dark as you possibly can. Now, keeping your hands super covered like this. I've never videotaped this before, so this is going to look kind of weird. But when your eyeballs are covered like this, open them up. And try and focus in to see your palm of your hands. So it's dark as you can see. Open your eyes up and try and focus to see as close as you can. And you're going to feel your eyeballs relax. Why? Because that forces them to dilate. How many people felt their eyeballs relax a little bit? It will. You do. Yeah, because that opens it up and it dilates it. You can do the same thing by sitting in a dark closet, but if you're doing it at work, people will talk. You know? Minnie, I don't know. She's in the dark closet now. We just don't know why. No, but you could do this at your desk in bright light. But you hold it for 30 seconds. Your eyeballs will be replenished, and they won't, cause a problem. So, hands for 30 seconds are a poisonous substance. Sinus headaches. Now, what's neat is you have 6 sinuses, okay? 2 up here, 2 behind the eyeball, and 2 behind here. Now, if you've seen me adjust facial bones, we do all the time. And why? Because those sinuses, in order to get a headache, they're literally behind here. They try and explode and move the facial bones out. We currently have 4 pharmacists as patients, and every one of them see me for sinus problems. Why? Because they know how devastating a Benadryl is. Okay, devastating to your immune system and health. So now, first off, how do you know if it's a sinus headache or if it's some other type of headache? Apply equal pressure. So you have sinuses in there, and they're trying to explode out. So what do? Just equalize the pressure. All you got to do is just put a mild pressure on the front and back. So just a little bit of pressure on your own head, just a little bit front and back. And if that feels better, then you know that the sinuses are involved. And then you can do the appropriate therapies to drain the sinuses. Does that make sense? Had a 10-year-old boy in here about a year ago. Very stoic kid, because if you've ever seen preteens, sometimes they want to act really tough and older. And he came in for attention deficit disorder. Okay, and I asked him, I said, do you ever have any headaches? No, fine, never have any headaches. And did he have ear infections? Yeah, a lot of ear infections. So ear infections mean that he probably had some type of cervical, some type of neck problem when he was a kid. So now, if I go in there and let's say I stab, Jeffrey in the neck with a pen, he would hit me. But if he was stabbed in the neck since birth, would he be consciously aware of that pain? No. So this 10-year-old boy, for 10 years, had a problem. So I go in there, and I applied a little pressure on the front and back of his head, and guess what he said? Oh. He didn't know. He didn't know. So this is one of the most underdiagnosed surprises that you'll find. But if you have a sinus headache, know the solutions for it. First off, you got to get your neck checked. And the reason you got to get adjusted is because the nerves that supply the sinuses can be hyperactive. That's why we're so effective in handling allergies. Has your arm ever fallen asleep before? I know every guy in here has, because when it's around your sweetheart, you don't want to move it, right? Okay, well, when it comes back, what's it feel like? It's all pins and needly. That's because if you pinch a nerve, it gets more sensitive. So if you pinch a nerve to the sinuses, it gets hyperactive. So all of a sudden, it'll overreact to cat dander, or it'll overreact to grass, or it'll overreact to, and people will diagnose you with allergies, and that's not true. It's just it's more sensitive than it needs to be. So first off, apply pressure. That'll find out if it is a sinus problem. Then, get adjusted. Spicy foods. The reason is, I'm going to go in detail, but there's an enzyme inside of spicy foods that actually dilates blood vessels and thins mucus. Water will thin mucus, and fresh pineapple has a natural anti-inflammatory in it. Now, these will actually solve most sinus issues. Here's an interesting one. The Clinical Journal of Pain. They found out that cayenne pepper, which is the only type of pepper you should use because it's a phenomenal herb, it's relieved by depleting substance P, which is a neurotransmitter that helps send signals. So it also has as a brain effect where it decreases your awareness of pain. If you want a good pain reliever or for sore, achy joints, put a little bit of cayenne pepper in some hand lotion and put it on. And you'll actually see blood rush to the area because it is a vasodilator. It's phenomenal. Make sure you don't have a cut, though. That'll wake you up faster than you can imagine. Now this, hydration, water. Why? Because if you have a problem in the neck and you're dehydrated, those discs are dehydrated, they have decreased movement, and that bone comes down, and that's 93% of the headaches. Alcohol dehydrates your system. That's where you get the headache. And don't say, well, okay, I'm going to drink with one hand and have water in the other. Well, it will kill the buzz, but water is vital. This means 50% of your body weight in ounces. So a 100-pound human being needs 50 ounces of water, minimum. But if you are taking medications, and the medication overuse headache is huge, do never, ever, ever, ever take two medications at the same time. If you're taking, and the most we've ever seen is 35 medications, 35 prescriptions in one patient. The average is about in the teens. But if you're taking more than one prescription at a time, you can have a huge reaction. So we always say, take a pill, wait an hour. Take another pill, wait an hour. Take another pill, wait an hour. And that'll decrease some of the toxicities. But in the middle, drink a huge amount of water. Okay, but this here, they call it medication overuse headache. They pinpointed the medications. What they did is they went back 15 years and they found medication overuse headaches. So 15 years of research, thousands of papers, and they found out that the causes remain the same. The name of the drugs and the type of the drugs changed. But the source of it, where it's over medication use, didn't change. And that's what was unusual, because we always say that, the new pain reliever, try this new diet drug, this new blood pressure medication. Over the 15 years, the types of medications changed, but the cause didn't. So all medications slow or stop a metabolic process, all pharmaceuticals can induce a medication-induced or a medication overuse headache. Isn't that huge? All medications? I thought that was unusual for a journal to say that. Now this, have you seen this advertisement? Better all over. Because if you have a child with a headache, how many people are parents in here? Yeah, I love my kids. Okay? If my kid's hurting, I want to help them. Would I ever give them something like this to cover up the symptoms? Well, according to this ad, it stops toothache, fever, earache, pains, aches. The problem is, this is out of the Journal of the American Journal of Epidemiology. Non-Hodgkin's lymphoma, this is a blood cancer. What they say, blood cancers are linked to all non-steroidal anti-inflammatories. This means Advil, Motrin, ibuprofen, Tylenol, aspirin. All non-steroidal anti-inflammatories are linked to cancer. I don't see that on here. Anybody see a warning that says, be careful of using this? It can weaken the immune system to such an extent that it can cause cancer? I don't either. Okay, well, so this, they're talking about antibiotics, which is a very, very commonly prescribed thing, also linked to that. But now why are we giving this medication? Because that's not an accurate assessment. First, let's look at the body. Is the body smart? Yes or yes? Is it built by God? Yes or yes? Yeah, it is. It's smart. It's brilliant. Now, you can see that this is a reverse curve in the neck. Now, we just saw a picture of anatomy. We know that this brain is connected to that spinal cord, and that spinal cord controls every autonomic function you have, controls heart rate, respiration rate, controls immune system function. Now, you can see that this cord might not be having that free flow of information, right? Do you think that the body, in its infinite wisdom, is going to let you know that there's a problem? Absolutely. Now, do you think that this might have less pressure on that system? Remember, the stats we just gave you, 93% of headaches are serogenic or come from the neck. Now, why would that be? Now, this is an MRI of this section here. This black line here is the brain stem. If you look, and the spinal cord, if you look at the spinal cord, it's not just a bundle of nerves. It's not like a telephone cord. It's a long tubular brain. It has its own function. So now you can see here that brain stem and spinal cord come down here, that it's pinched. So is the body going to let you know that it's pinched by giving you pain? Yes. Oh my gosh, because this controls every function in the entire system. So that means if we have a system like this, where that spinal cord is pinched, the body's going to give you that signal to tell you that there's a problem. Yes or yes? Now, this is the crazy part. How do most people treat a headache today? What does the TV tell you? Take Tylenol. Yeah. Now, according to the Center for Disease Control in Atlanta, Tylenol is the deadliest drug in America. It's deadlier than heroin. In fact, it's deadlier than all illegal drugs combined. Tylenol is. Yeah, they don't say that in the ads, though, do they? Okay, so now, but you could say aspirin. Aspirin's the leading cause of kidney disease. But to cover it up, none of those make sense. If it's Tylenol deficiency, that makes sense to me. If it's aspirin deficiency, that makes sense to me. But this, knowing that symptom is there, it's trying to protect your body. Now, Journal of the American Medical Association. Non-steroidal anti-inflammatories. I just showed you an article that shows that non-steroidal anti-inflammatories are linked to cancer. Yes, bad, right? Okay. This one, in hospitals alone, this is a controlled environment. We know these people are sick. We know what drugs they're taking. They're given a drug, so there's no possible chance of an overdose. Well, generally not, okay. And 16,000 people a year die in a hospital setting, taking a non-steroidal anti-inflammatories. That's why. Do you think I have aspirin, Tylenol, Advil, Motrin, or any of those things in my house? Do you think any of my family members, my sisters, my mom, would have any of those drugs? No, because it's illogical. It's not an accurate way to treat a human being. There's many other more effective alternatives. Aspirin. American Association for Cancer Research. They say that it's linked to pancreatic cancer. This is, again, a non-steroidal anti-inflammatory. The problem is this causes disastrous results. Have you heard of an aspirin a day for a healthy heart? Yeah. Really, Bayer paid $1 million in fine in 2007 for making that claim. Aspirin is not just a blood thinner. It's a very, very powerful drug that can cause kidney damage. It's the leading cause of kidney disease, and one of the leading causes is strokes. So it's a very, very powerful drug. But this one says there's a significant increased risk of pancreatic cancer in women. So again, to take a drug to cover up a symptom doesn't really make a lot of sense to me. Now, deaths per year, now this might be hard to see. The biggest one is tobacco. That's the biggest killer. Properly prescribed drugs. Now look at this. Properly prescribed drugs. Not improperly. Not overdoses. Not taking the muscle relaxant, anti-inflammatory, the pain reliever, and the Depakote together mixed up, causing a drug reaction. These are properly prescribed drugs. Alcohol and illegal drugs. So when you drive by the high school over there, and it says drug-free zone, I'm hoping that in my lifetime they'll be talking about this area, not the little tiny area on the side, because that's the real killer. But this, do headaches cause pain? Yes or yes? Guess what chronic pain leads to? First off, if you're hurt. Good, that was meant to scare you. Were you scared just then? Yes, you were, okay? Pain does the same response. Under fear, and this is perceived danger, okay, your body goes into the fight or flight system, okay? Under pain, it also goes into the fight or flight system. In fact, can I stand on your foot just for a second? Okay, see, okay, ow. Okay, under pain, his body goes into what's called the fight or flight system. So now what happens if you're being chased by a tiger? It's the same thing. So now if you're being chased by a tiger, what happens to the heart rate? Okay, let me ask it a different question. If you have a headache, what happens to the heart rate? It goes faster. Exactly. Now, if you're being chased by a tiger, do you need a lot of available energy or a little? So if you're being chased by a tiger, your liver breaks down glycogen to glucose, blood sugar gets elevated. So that means that if you have a headache, what happens to blood sugar? Goes up. Oh my gosh. Do you want blood going to digestion when you're being chased by a tiger? Or blood going to arms and legs when you're being chased by a tiger? So when you have a headache, what happens to digestion? It gets shut down. When you have a headache, what happens to cortisol, which is its primary role is to downregulate insulin receptors. So headaches, chronic pain, will lead to diabetes, absolutely. It will absolutely lead to high blood pressure. It will absolutely lead to digestive anomalies, irritable bowel syndrome, malabsorption syndrome. It will absolutely weaken the immune system. Under any physical, chemical, or emotional stress, it weakens the immune system. And then, how about this? You get pain, the immune system's weak. Then you take a toxic substance such as aspirin, Tylenol, Motrin, or Advil, and we already showed are proven to cause two different types of cancers, non-Hodgkin's lymphoma and pancreatic cancer. That's a deadly combination. Increased cancer rates and early degeneration. Why? Because we're missing the main cause of it. So now, can anyone in here understand when I hear at a party or someone says, oh yeah, I used to have a headache, but I just took a Tylenol. I'm fine. And my jaw drops open, and I leap across the table, and I grab the person, and I start shaking them. They think that's an overreaction. It seems normal now, doesn't it? It's like, oh my gosh, your life is shortened. Welcome to the half hour to health. Okay, I like this. Now, this is out of an older book. People are still reading it, though. It's still pretty popular. People are destroyed from a lack of knowledge. Boy, that accurate. Now, have you ever heard, first off, headaches. We're talking about headaches and migraines. Is that a big problem? Well, according to Business Week, $13 billion a year. Now, they say just on treating migraines, $1 billion a year. But now, that seems like quite a lot. How are they treating it? Well, first off, what's a headache? We're going to go over anatomy and physiology a little bit, because if we understand that we're genetically designed to be healthy, only 10% of the nerves that emanate or come out of this body transmit pain. That means 90% of the body's function is on health. Only 10% is aware of it. Now, this brain is phenomenally important. And what they're talking about headaches, that means brain pain, where your brain's hurting. Well, let's look at this. Now, if you look at the actual anatomy of the brain, frontal lobe, parietal lobe, occipital lobe, The most important aspect of this is how it's structured. Each area of the brain has different functions. Now, have you ever heard that sometimes football players can have violent reactions? Have you ever heard that before? Okay, do you think it's the steroids? Or if you've ever had trauma to the front of the brain, frontal lobe is responsible for emotional inhibition. So if you've had multiple head traumas or boxing traumas, there might be some emotional aspects to it, but that could be a physiologic change. So understand that this area keeps you alive. If it's throbbing in pain, should we cover up those symptoms? No, that doesn't sound real effective in health. But let's look at some specific areas. First off, all of this area goes on perception, or tells you about what's going on with your environment. Like right now, if I was to take Minnie and sit her on an iceberg, okay, I love her, I wouldn't do it, and her husband would kill me. But what her body would do, it would shut down blood vessels to the extremities. It would shut off, so her toes got so cold that they'd break and fall off. Her fingers would break and fall off. Is that an intelligent response to being stuck on an iceberg? Yeah, because it keeps her core temperature alive and keeps the body alive. So what that means is that this brain functions by getting responses from the environmental stimulus. Okay, that's how it gauges health. One of the most important areas of the brain is this brain stem area. Now, the brain stem actually extends down to the top portion of the neck. Now, the reason I'm bringing up anatomy and physiology is because any pressure on this brain stem area, look what it controls. Autonomic functions. This means the automatic functions. It controls heart rate, blood pressure, limb movement, visceral functions. This means digestion, food processing, immune system functions are all controlled by this one particular area here. So if that area of the spinal cord and brain are affected, it massively decreases your life. Okay, so if this area is not working correctly, heart rate, blood pressure, immune system function, digestive function, does that seem important? Okay, so now, let's say that headaches and migraines are sensors. Okay, it's like the red light on the dashboard that tells you that there's a problem. Does that make sense? Okay, it does. Now the fact are, let's look where headaches come from. 93% are serogenic. It means they come from the neck. This includes tension headaches. It includes most sinus headaches. It includes what are called referred trigger point headaches. All of those are the most common. Now about 7% of headaches come from toxicities. Now these are old numbers. Right now what we're seeing, toxicities, drugs, dehydration, this is actually getting more and more and more popular. Now, there's solutions for those two types. Less than 0.1% are from tumors. But we're finding out now that this is a percentage that's rising. Okay, and I'm going to show you why it's rising and what population is rising, because I'm actually in the population that happens to be getting a lot of brain tumors. No, it's not from watching TV, so Mom was wrong. Okay, but what happens is, between 1955 and 1963, they came out with a polio shot, and it was actually an infected polio shot. Now, we talk about polio shots and vaccinations in detail when we go over the vaccine lecture, and I do mention that in that time frame, they had an infected batch. What that means is, have you ever grown a vaccine? Well, what happens is, on vaccines, you actually need living tissue. Now, the polio virus grows really, really well in rhesus monkey tissue, and that's what they used at the time. The problem is those monkey kidneys, where they grew the virus, was loaded with viruses. And one of them happened to be the SV40 virus, which is a simian virus or monkey virus. Now, in the 90s, Michelle Cairborn, professor of pathology, she found out that the SV40 virus was in most cancerous tumors. And this happens to be in brain, lung tumors, bone cancers, but it's between 40 and 60% of mesotheliomas. The people who live in Massachusetts and Illinois who received the hot lots, those are the group that had the highest ratio of the simian virus, the SV40 virus, they have 10 times the amount of osteosarcomas, brain tumors, than people who got the non-contaminated version. But just know that if you were in this age group, and I'm one of those people that were in this age group, that you are at risk. Now, what's the solution for this? is a strong immune system. If you have a strong immune system, you will not get the brain tumor or other pathology. But this is huge because now here, Italian researchers, because this was back 40 years ago, what they found out was, though, that there's populations that are getting this monkey virus transmitted. Now, this sounds kind of like a bad science episode where they make a polio shot, okay, they infect the mom, and then it spreads throughout. In fact, they just did a movie on that with Will Smith. What was the name of that movie? What was it? No. I Am Legend. Yeah, where they did a vaccine and it ended up creating a mutant. Well, this has mutated. Okay, right now, they're looking that the SV40 virus is now transferred in the blood tissue. Now, this doesn't have a lot to do with headaches except for the tumor growth. But I found this out today, okay, that it is being transmitted. So the only way to protect yourself from these type of cancers caused by the polio shot that was 40 years ago, okay, is to keep a strong immune system. And luckily, that's one of the solutions for headaches. Now, I love this. Headache drugs can actually give you a headache. Now, this is out of the Journal of Head and Face Pain. Now, remember, the brain's important. It's so important that it governs every function of your body. It controls all the autonomic functions. Now, you're going to see a lot of solutions for headaches, but I don't put one thing in here that you should take an aspirin, a Tylenol, an Advil, a Motrin, an Imitrex, a Vicodin. There's a few more names that I'm forgetting there. But to take a pain reliever that covers up the symptoms is illogical. You wouldn't let a dentist treat you this way, so why should we take the control center? Yes, miss, you have a rotted tooth here. Take this pain reliever, you'll be fine. You'd fire the dentist, wouldn't you? Yeah, so would I.